So, good afternoon. On our Monday, as usual, we'll talk about what went on over the weekend with some data and information. Some of it's encouraging, others is concerning. And so we'll be covering both those this afternoon. And so with the numbers and some comments, I'm going to hand things over to Dr. Yaffe.
Thank you very much. Good afternoon, everyone. Since the last update we provided on Thursday, Ontario has reported an additional 16,056 cases of COVID-19. Of these, 4,505 were on Friday, 4,094 on Saturday, 3,947 on Sunday, and today 3,510 cases. That brings our 7-day average of daily cases to 3,917, which is down from 4,348 1 week ago. Ontario has reported over 4,000 daily new cases for the 3 of the last 7 days, and that does demonstrate some improvement. Sadly, we are reporting an additional 106 deaths since last Thursday's update. I do want to take a moment to extend my condolences to Emily Viegas' family. It's a tragic situation, and our hearts go out to everyone who knew her. We also extend our deepest sympathy to the families, friends, and caregivers of those who have passed away from COVID-19 and all those mourning the death of a loved one in these very difficult times. Hospitalizations and ICU occupancy are once again at their highest level since the beginning of the pandemic. Today, there are 2,271 people in hospital, and 877 of them are in ICU. In terms of testing, 33,822 tests were processed yesterday, with a positivity rate of 10.9%. That is the highest positivity rate since the pandemic began. Our current 7-day average for percent positivity is 8.8%. There are now 54,949 confirmed cases of variants of concern in Ontario. The vast majority are still the B117 variant, which was first identified in the United Kingdom. The 7-day rolling average positivity for mutations or variants of concern is 75.2%. We have also detected a total of 36 cases with the B1617 variant, which is a variant of interest in Ontario. B1617 was first reported in India in late March and has spread to at least 20 other countries around the world. 6 cases were detected through Public Health Ontario's genomics surveillance program, all of which were associated with international travel. In addition, 30 cases were identified and detected through Ontario's COVID-19 airport and land border screening program through the National Microbiology Lab in Winnipeg. Currently, this is being classified as a variant of interest, not yet a variant of concern. Generally speaking, a variant of concern demonstrates evidence of increased transmission, causes more severe disease, or leads to reduced effectiveness of vaccines or treatments. A variant of interest, however, contains mutations that have the potential to cause these negative effects that we see with VOCs, but currently we lack the evidence to definitively demonstrate those negative effects. We are continuing to actively monitor for the B1617 variant as well as other mutations and variants of the SARS-CoV-2 virus. I would now like to turn it over to Dr. Williams for some additional comments.
So, yes, I'd like to offer my condolences to the Viegas family and friends, and as well as others who have suffered consequences of it recently. This is most unfortunate, and it's what we feared with the variants and this third wave, as younger people are impacted by it, and some, as Dr. Heyer talked about last week, are actually coming quite ill in the home setting, and unfortunately some are passing away in that location. So the third wave is not to be taken lightly at all. It is challenging everyone, and everyone has to do their part to monitor, to be careful, and to get assessed as soon as you can if you have had exposure and concerns, and to ask for your primary care physician or others what you should do under each circumstance, even if it seems in your mind trivial at that time. So you want to monitor your situation and be timely in your access to services if and when necessary, and to support family members who are going through the same thing. This week, we are celebrating National Immunization Week, and it's how fitting we're doing all this vaccination and immunization at this time to try and deal with COVID-19. To date, we have administered more than 4.6 million doses of COVID-19 vaccine in Ontario. And in the coming weeks, we anticipate larger increases, especially of our Pfizer vaccine, and we anticipate some other vaccines arriving when we get confirmation, both of the Johnson & Johnson, as well as we're waiting to see if we'll get some of our supply later in the month of the Moderna vaccine as well. So right now, we're looking at the increased Pfizer availability. And while you've heard us say before, vaccine alone, we can't vaccinate ourselves out of the third wave, because we still need our public health measures and all these other steps we're taking action on, including all the ones you know about distancing, masking, staying away from others, household contacts only, staying home as much as possible, and taking all the different aspects we've asked you to under our public health measures during the stay-at-home order time. And as you've seen in the data Dr. Yaffe has presented, we are starting to see the bending of the curve. In some areas, we're seeing it actually coming down. Some others are still up there, and especially in our high rate areas, are still showing some leveling off, but we haven't confirmed that yet, and we want to monitor those as well. But overall in the province, it looks like we are making progress and coming, but this is just a few days, and I don't want to be overly optimistic and saying because you can dip down and go back up again. We cannot take our foot off the brake on this one. We have to do everything we can to be careful. Along with the vaccines, it's important for us to keep the public informed on any of the so-called adverse events of our vaccines. And we have a very active adverse event reporting system, from mild ones such as severe pain or pain around a local injection site, fever, different things that people would report to their primary care doctor or to the site where they got vaccinated. We need to know those. We like to access that information so we can record that, because we are convinced the vaccines are by far safe. There are risks, as in anything, and we want to understand that. A lot of talk has been talked about lately with the so-called blood clotting issue related to mostly the AstraZeneca or the Covishield vaccine. They're one of the same type of product. And the case is what is called, it's a long word, it's vaccine-induced immune thrombotic thrombocytopenia, or VITT acronym. So VIT. Last week we reported 2 cases of VIT in Ontario. Today I'm reporting a third case. The individual, this time is a male in their 70s, who developed a blood clot following the receipt of a Covishield or AstraZeneca vaccine. The individual is currently receiving treatment in hospital. So I know that there's many reports of serious adverse that may cause concern around the AstraZeneca vaccine. But as you know, we have recently had a further update from our National Advisory Committee on Immunization that has lowered the age down to 30. Still in Ontario at this stage, we're going 40 and above because of our supply issues, that we only have so much to utilize, and we want to get that age group done. Nevertheless, if physicians have some other concerns, they can deal with that on an individual case-by-case basis. So these reactions are still rare, as we talk about 1 in 100,000, 1 in 250,000 of the doses given. and so far we've given about, actually administered 650,000 doses of the Covishield or / AstraZeneca vaccine here in Ontario. So we are continuing to monitor the situation. We are continuing to document these, to investigate them, and in partnership with our federal, provincial, territorial team, we're looking at those on a national basis because we want to be advised if there's any undue concerns. We'd be letting you, the public of Ontario, know and advising our healthcare community and our physician community accordingly in that. And so we are doing this not because we feel that they're unsafe. They do have a slight risk, a low rate risk, very small compared to other some medications similar, and very low compared to getting COVID and the complications of COVID. So we still want to encourage everyone, when is your turn or opportunity to get a vaccine, to obtain the vaccine and to have that administered, especially during this immunization week, because already we're seeing many strong indications of the benefit of the immunization as our case rates in the older population groups, those over 60, definitely those over 80, and our death rates have come down, as well as our hospitalization rates in those age groups are coming down. So it shows you that the vaccine is working, and so we are hoping, and our plan is to have by the end of this month, or the 1st of May, 40% of our eligible population vaccinated with it. And that will be a huge achievement and one we're looking forward to. So the messages are, get vaccinated when your chance is an opportunity to have one, and continue following the public health measures, because we need both going strong together. And I think we're seeing evidence of that turning. We have to continue to drive it down even further in these weeks ahead, because we still have our high admissions to the intensive care units. That is a delayed metric that will continue to accrue, unfortunately, over the next week or two until we turn that one around for the solidarity of our healthcare system as we help our frontline workers deal with this very huge load, and as we help them try to get those case numbers down again to relieve the pressures on them and on our healthcare system. So with that, I'm going to hand over to the media for questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
From John McGrath with GVO.
Hi, good afternoon. The province now has about a quarter of the population partially vaccinated, and obviously in the next month or so, that's probably going to get to at least half, and then 100% hopefully people eligible by July or so. But there's no real guidance from any kind of provincial public health officers about how people who are partially but not completely vaccinated should behave, what cautions they should take, or what activities they can feel a bit more secure in doing when the immediate crisis in ICU and hospitals passes. Is the province going to make some kind of guidance available to people? Because it's going to be months before we have a fully vaccinated population, and there's going to be this really sort of questionable middle period.
I'm going to let Dr. Yaffe start off, and I may have a comment to add afterwards, but thank you. It's a good question.
Yeah, thank you. That is a very good question. I think, first of all, we know that after you get a dose of vaccine, usually it takes about 2 weeks for your body to develop the antibodies, the response, so that if you're exposed, you have antibodies to respond. So if you get the vaccine today and you get sick in the next few days, that is because you were exposed before and you haven't developed a response yet. I know people feel the minute they get the vaccine, that's it, I'm protected. And of course, you're on the way to getting protected. I do want to stress that we are giving one dose of vaccines, other than J&J, which is coming, that require 2 doses for full protection. So the data shows, for example, that with Pfizer or Moderna, 1 dose will protect you from severe illness, about 60 to 80%, 80% for hospitalization, 85% protection for death. So it's very effective for preventing very serious illness. For full protection, you need the 2nd dose. And so right now, we're saying if you had 1 dose, excellent. but keep doing all the same public health measures. We have started to work with Ministry of Long-Term Care to change some of the restrictions in long-term care because we have such high vaccination rates. The residents there, virtually 100%, depending on the home, have 2 doses. They are fully immunized. But that is not the case in most instances. So really, it's something, of course, we're continuing to learn from other jurisdictions, what their experience has been with 1 dose. But I think the bottom line is assume you need to take all the measures, even if you've had 1 dose.
And I would just add that our public health measures table is looking at how one might incorporate that into our structure. And as Dr. Yaffe said, while 1 dose on a population basis, and depends on age and individual circumstances of people, gives very good coverage against severe consequences. People with 1 dose can still transmit in there and have mild illness. And we want to make sure we have a larger percent of our population vaccinated with 1 dose at least, and then we're going to look at to say what does that allow or permit one to do in there. And so our public health measures table and others are looking at this to ascertain what we might allow and permit with 1 dose, knowing that by, we think, into the end of June or July, we'll get into a high percentage. And of course, we will, if vaccine supply permitting, which we think is looking promising, we will start to undertake to give people their 2nd dose in the timelines of which we originally ascribed to. So thank you for your question, and I would say we'll be updating you as we get more data and information on population immunization rates.
Follow-up?
You know, I think at the moment with the crisis in hospitals, it's fair enough to tell people that they just have to stick to the public health measures. But, you know, we're still months away from the majority of people having their 2nd shot. Is it really realistic to tell people or to ask people who have 50% of their doses to act like they're 0% protected? I mean, it sounds like people are not actually going to do that, and for lack of a better word, I think that there needs to be some sort of realistic acknowledgement of that.
So I think I would say at this stage, it's like saying if I'm wearing a mask, I can go and socialize with anyone up close and sort of looks like it's half as better than nothing. I would really caution against that in the present state of the variants that we're seeing and the impacts. Because while you may have had 1 dose, if it's not with your household and you're not using your precautions, you still might be carrying it, and you may transmit to someone who you thought was vaccinated and is not vaccinated. What gives you some reassurance, and that's good. At the same time, it doesn't negate your need to be responsible for those around you at this stage until we can say most of the times you're in contact with these people, they've had 1 dose as well. But right now, the majority of people have not had 1 dose. We do not have 40% of the population vaccinated at this stage. So once we get to a certain level, we'll be communicating accordingly. But remember, our hospital rates are still high. Our ICU admissions are still very high and going up, and we really have to stay the course at this stage. So self-reassurance, but not lack of responsibility for those around you.
Next question.
Brian Liley from the Toronto Sun.
Hello, doctors. I'd like to hear your thoughts on calls for further restrictions at airports. We heard last week from the federal government that direct flights from India and Pakistan are banned for 30 days. The government continues to say that travel is not an issue. The federal government says travel is not an issue in about 1% of cases, but that's the same line they used in December when the concern was the British variant, and now it's 75% of the cases you're dealing with. So with about 2 to 2.5% of all air passengers arriving in Canada testing positive, do we need to be concerned about Pearson Airport remaining open to air travel?
Well, that's an excellent question, and it's one that concerns me throughout. In Ontario, especially because we have such an international hub. We are like a global touch point for a lot of places, and people from our communities and our valued various communities have many links back to their countries at different times, and the need to travel sometimes and desire to travel quite often, of course. And we want to be concerned about that because some can bring back a lot more than just some memories and thoughts and that. And we're very concerned about these variants from these different countries. I don't think, in my mind, that the system is as solid as it should be. I think we've had many points where we see it is less than consistent in some areas. So we are continuing to be concerned about that, as some of my fellow CMOHs across the country who have international airports are concerned about that, finding more and more people coming positive in there, and we are worried about that in coming into our own respective jurisdictions. We are trying to get ours under control, but as you've seen with some of these ones, all you need is a few coming in, and then if they're not picked up, then spreading rapidly among a vulnerable community, you'll then have many cases. So with the reproductive number the way it is with these variants, it can move very quickly from 1 up to 30 to 50 to 200 or 300 in a period of 2 to 3 weeks, and we've seen that. We do not need that. We don't want that. That means while we understand some people are traveling, we want to really set up a better system to monitor that, not trying just to be difficult, but we want to protect those that are coming, but more who they're coming in contact with here back in our province of Ontario. And I think my fellow CMOHs feel the same across Canada. This is a point we really have to be careful with because unlike some areas, we're not an island. And isolation, we can't close that off that easily. So I think it's something we have to continue to work with our federal counterparts. I know at our Federal Provincial Territorial Committee, we'll continue to have these discussions trying to enforce that and to put in a stronger, firmer, and better systems to protect our community and the citizens of our province in that way.
Follow up?
Actually, if I could just, add to that. I know they quote that 2% of the cases are travel-related, and 2% is obviously quite a small percentage. But as Dr. Williams said, these cases then spread it to their household, to other people they're around, and now we're dealing with the vast majority of our cases, our variants of concern that have originated in other countries. So the fact that 2% are directly travel-related, of course, is important, but it doesn't represent the burden of illness that's associated with international travel. And I do think we need to look at non-essential travel and really cutting down on that. Obviously, there are some things that are essential. I mean, the vaccines are coming in through Pearson. We obviously want those. But I think this is an important issue to be dealt with, and we're working with the other provinces and the feds as well.
Follow up?
Okay, so then I have to ask a double-barreled one, so please forgive me. What can be done on non-essential travel, just for passenger trips? You know, I under your regulations, I'd be breaking the rules going to Hamilton 45 minutes down the highway to see my mother, but I could go see her brother in Glasgow, and that's fine. So I'm wondering how you square that. Should we just be shutting down people who are going for vacations, who are going for family visits, and say no? And also, do we need to tighten up quarantine restrictions? Since starting to write about the border, I have heard numerous stories of people either, they say they have a quarantine plan, but the plan is to go home and stay in the house for 2 weeks while everyone else in the home goes to work, goes to school. This has happened with both students living in a home filled with, as many as a dozen other students. It has been in homes where there are lots of people going into the community. Do we need better quarantine rules as well?
So I think, what you raise a lot of good points in that, and if we're going to have a proper screening program that's effective, there's two things. One is Dr. Yaffe is alluding to. We're asking people in this global reality, because there is a huge global thing going on. When one area is quieting down, others are rapidly increasing. And we see this now, unfortunately, the devastation that's happening in India. I'm not sure what's happening in Pakistan and other countries around there, but this can flare up very fast. And so while one settles down, another one picks up. And so what one thinks they thought was essential, they should really think about it very carefully. in that, and we're trying to discourage non-essential travel in that. But one point we're finding again and again, it just as in our measures here, there's people in our province that choose to say, I don't think this is that important, and choose to disregard some of the precautions and measures. And then after they're in, like you give an example where someone travels, quarantines at home, does not stay down in the room, does not have that separation from the rest of the people in the household. And then after a number of days, they come ill and they say, I just didn't think it could have happened. And then the family's ill, and then someone has to go to hospital. Do you really want to live with that? It's really tough, and you really have to take responsibility. So what you think is not a critical issue, you have to take this very seriously. And if you're going to be involved in that, if it was an essential trip, you get the testing done the right way, you follow the precaution the right way, because you may think you're invincible, but you're not, and you may be the conduit or source to an infection to loved ones around you, and that can be devastating and a consequence you may have to live with for a long time. So we would like to strengthen that. It does require that people cooperate and participate in that, and so we're going to continue to try to look at how we can do that better and better, because if you've given examples where people have been less than careful and fully adherent, and people find workarounds, unfortunately, where they think in their minds it's not a big deal until they become sick and their loved ones become sick, and then it's too late. It's like trying to put the seatbelt on and say, well, the car is rolling. It's too late. And you really have to be careful, because these variants are quite different than the other ones you had in the past. So we can't stipulate that. So it's a combination of what we put in, how much we can enforce it, but we need people to be very serious and careful about this. If you really have to travel, do so very carefully. You don't know what you're going to get into, and you don't know what may come back with you and what may happen to you or your family. So be very cautious in this, and we'll do our part. You need to do your part.
Last question.
From Sneha Agrawal with CBC News.
My question is for Dr. Williams. A 13-year-old girl from Brampton, a provincial hotspot, has died, and her death is being linked to COVID. What is your reaction to this young girl's death, and what it says about how dangerous this virus is to people of all ages as this third wave continues?
Well, as I said at the outset, this is a very sad situation. It's not one that I want to be facing. It's one that I was very concerned about that we would be dealing with. We've heard in some other parts of the world more and more younger and pediatric cases being hospitalized. We have, fortunately, up to now, have not had a large number. Our pediatric centers still tend to be not filled or heavily utilized, and we have been fortunate. The variants of concern, and the ones we're dealing with now, do have a predilection more and more for the younger age groups. And what I was hoping not to happen did happen. And I'm concerned that it could happen some more in some cases. We have to be careful. Families have to be careful. It can move very quickly through and impact very quickly. People can go from a moderate, mild to severe. So you have to monitor those individuals carefully. So I just can't understate how important it is, overstate how important it is to put all those precautions in place, especially in this third wave when we're dealing with these variants of concern and how it moves quickly through all groups, whether it's in a workplace or whether it's through a congregate setting or in a household, an extended family household. Monitor everybody carefully, assess them, and if there's any concerns, contact healthcare. It's still better to go and get seen and get assessed to be sure than to be uncertain. And we want to try and help you in all the ways we can. So we have to take it very seriously. And our measures, we have to be very serious about adhering to them, because we don't want to be trying to deal with that issue. We want everyone to put all their precautions on full guard for the next number of weeks, especially as we try to beat this third wave down.
Follow up, and this is the last question.
What are the chances overnight or day camps will be allowed this summer?
Well, that is another good one. There's a lot of things on the move there. Of course, we know the value of overnight camps, but we know the risk in overnight camps. Even before COVID, we've known sometimes when overnight camps and you get an outbreak of a gastrointestinal condition and everybody is quite sick and the bathrooms are overloaded and that. So you have to be very careful in those settings because they're in very close contact. So we're going to have to look at how we might do that with our vaccine program continuing, with the possibility that they may be bringing in vaccines for adolescents. So there's a lot of things that are shifting and moving at this stage. We got to get out of this third wave and we got to keep it suppressed. So we don't want to have an overnight camp situation becoming a very sad situation with outbreaks. So we would like to get there. There's a lot of things we'd like to do this summer. But we're going to have to wait to see if we get this third wave beaten down and to keep it down and to keep our vaccines rolling. So I can't give a definitive answer on that at this stage. I would have liked to, but there's too many things moving at this stage. But as soon as we think there's a way to do it, we will be informing the public. And, of course, we know the organizers of these facilities that have been always a great source of not only fun and enjoyment, but memories for many youth is something that we take seriously, but we take it seriously that it should be done in a healthy and safe way.
Thanks, everyone.